Hello, I'm Zion Gibbs, and I'm working with Joshua Freites in the class gerontology on the changes of aging and how to promote environmental safety and security. In Chapter 13, we are covering a safe environment for the elderly. As you see, it's defined as one in which the older person is capable, within reasonable caution, of carrying out activities of daily living and instrumental activities of daily living, as well as the activities that enrich one's life without fear of attack. This would include promoting safety measures in order to prevent falls and injuries and increase security on the following, and increase safety, On the following slides, I'll point out the importance of different variables and different safety measures we can use in order to promote safety in older adults. Next slide. Vulnerability to environmental risk and mistreatment by others increases as people become less physically or cognitively able to recognize or cope with real potential hazards. Sometimes as the elderly get older, they're not mentally there all the time. They're not alert and oriented all the time. Sometimes they're on psych meds. Sometimes they're very lethargic, and it causes them to become more sleepy and increase their risk for falls. So in order for us to promote a safety environment, we have to make some changes around the house in order to do this. For example, if a patient had a sensory deficit or anything like that, any kind of decreased sensation, any kind of neuropathy, especially with our diabetic patients, sometimes they don't check their feet to check for ulcers or any kind of openings. It can cause foot ulcers or heel ulcers and increase their risk of infection. So let's continue. Some health trends and health concerns. Sometimes the older patients have disabilities. They often occur after falls, post-surgery. Sometimes they have limited mobility once they have hip replacements and knee replacements. Sometimes even they have to be on crutches or they have to use a wheelchair, and it's harder for them to move around before they got the surgery. So a lot of elderly patients also have some visual deficits. Sometimes they're hard of hearing, sometimes they have a decreased sensation. With the visual deficits, they may not see if something's in the floor. They may not know that maybe they left some shoes on the floor or left a cane or anything like that that can cause them to fall. So with this, some people who are visually, legally blind, sometimes they have this deficit causes them to be at increased risk for falling. Also, for the hard of hearing, they may not hear what's going on outside. They may not know that the TV may be too loud. Without hearing aids, definitely it will be a barrier. They don't know when somebody's knocking at the door to tell them that maybe the house may be on fire or anything like that to kind of just decrease their awareness of the environment. Also, all of these sensory impairments can lead to a higher risk of injury and or death. Therefore, safety is important and very detrimental to the patient's health and well-being. Some nursing interventions that we can do inside the elderly's home will first of all include the bathroom. Sometimes even with the elderly, they have a frequency in urination and constantly using the restroom. So having raised seats in the bathroom, like a bedside commode, so they don't fall on the toilet, they can actually sit and have the side rails to kind of secure them as they slowly go down and not just plop down. Because that can increase the risk of broken bones or any kind of fractures because of the intenseness that comes with falling. Also, in the hospital, when we do charting, we have a Hendricks scale, fall scale. And more times when there's a patient that's a male, they increase their risk of falling because sometimes they don't always ask for help. So with elderly patients, they definitely have to be more open to help, and especially with the men, just because they are men and sometimes can be a little bit more stubborn when it comes to asking for help. They're definitely susceptible to falling. Another thing that we can do for the bathroom, we can also, sometimes when the patients go in the bathroom, they may not bring their wheelchair. They think it's a quick, okay, I'm just going to go to the bathroom and I'll be fine. Sometimes they need those transport devices in order to get to where they need to be and leave them at the bathroom and not just think they can do it on their own. So leave their wheelchair at the door and then they use a walker. Any kind of transport device is beneficial to decreasing the risk of falls in these patients. In the bedroom also, we have sliding rugs. They should definitely be moved. Any kind of rugs that can cause falls or any kind of sliding or anything that's not set in place can definitely increase the risk of falls and possibly in a surgery patient. In the hospital, we also have some adjustable height beds, bed heights, basically. We don't keep the patient up high in the bed because we know if they try to get up, they can easily fall to the ground. So we try to keep their bed at the minimum in order for them to move around, with assistance most of the time. But even if they can get up, we keep their beds at a low way low setting. Also, with the bedrooms, we have the bedside foam and non-skid wax floors. We don't want to have slippery floors for these patients. In the hospital, we also give out socks, non-skid socks, to help them prevent from sliding on our floors. Because sometimes we can have our environmental services come in and clean the floors and wax the floors, and the patient may try to get up while the floor is still wet. So we have these non-skid socks to kind of help prevent the sliding or the slipperiness, or sometimes we just tell them to wait for a few minutes to, use the restroom. Also, in the kitchen, we have we can use, easy access to reach certain things. They don't have to reach certain heights in order to get the food or things like that. We should have some lower set cabinets or easier access to get to different basic needs. Another thing is to have adequate lighting all around the house, not to be dim, but always have it clear so they can see anything that's in their way, or have their glasses always at their bedside to make sure they put them on before they leave the bed. Just things to make it easier for them to transport and to see what's going on. In the living room, sometimes we have chairs and lazy boys, the recliner sometimes can get in the way if they're not sitting up straight. And sometimes we have to relocate these things in order to make a clear path. Any kind of swivel or rocking chairs can be a hazard to the patient falling or to the patient getting hit by anything that moves. So definitely those things can be, immobilized in the point to they can't move. Or if they do move, we got to put them in a safe situation or a safe area so that the patient is not increasing their risk for falls. This concludes my part of gerontology, safety, environment, and security.
Hello, I'm Joshua Freitas, and I'm here to continue the presentation for gerontology about elder safety, environmental safety. And I'm going to continue with Ms. Zion Gibbs, who was presenting previously, and I'm going to start off with nursing interventions. Okay, so when we're talking about the older population, there's lots of different things that they're not able to do due to their older age. Some of those things are going to be using a telephone. So there's different problems there. They may not be able to reach this telephone. So we're going to do interventions like give them the grabbing stick so they can reach it. In the case that it's a cell phone or something that's across the room, that's just one of the things you can do. Problems with cell phones or telephones is they have problem hearing because they have degenerated hearing, and maybe they have some hearing aids in. They can't hear it ring, so another good thing is to have some lights and some vibration to go with that. If they're having difficulty dialing the numbers, then of course you can always get bigger numbers on the screens. Now these days the phones have huge screens, so you can look at that as an intervention to have bigger numbers or have a bigger screen for the phone. Big safety concern is steps. You never want anybody to fall, and in the older population, falls can be very detrimental to their health. So you want to make sure that if you have a staircase, they're able to actually get up it on their own using possibly handrails or something they can hold on to. If there's no handrails available and they're unable to use a walker on the stairs, which seems dangerous anyway, then you can always use a lift, like a chair lift or something, so they can be guided up the stairs easily. You always want to look out for loose carpeting or rugs in this situation, because you don't want them to be slipping on some loose carpet or rugs. So if you do have a loose rug, you can either nail it down or do double-sided tape to tape it down, or just remove it altogether. And another intervention is when they're walking up and they are having trouble seeing, which is a big problem. Then we could put up some lights just to kind of illuminate the stairwell. Home management is, they may not be able to do their activities of daily living as easy, so things like laundry and housekeeping and that kind of thing is going to be maybe a little harder for them. So in that case, you can always get some help, maybe family members or home health care would help do that. And if not, they can always use assistive devices such as walkers and that kind of thing to kind of get themselves over. I've even seen the rascal scooters used so they can cruise around the house and do what they need to do. Opening and closing doors can be dangerous, because if you have a door that won't open, or it's jammed shut, like a window, or that you just can't open, it's good to do preventative measures to make sure that you are able to keep the tracks greased up so that you can open them and they're not dangerous to shut. So there can be some security measures to ensure that they're not dangerous to shut, and they're able to do it on their own. Another thing about the house and safety is that they may not be able to hear like their alarm system. So if an alarm system is going off, they don't have their hearing aids in, they may not be able to hear it. So it's always good to maybe have some lights and some kind of vibration or something associated with that, so that it's not just the alarm that they're hearing. And also, in the house, walking around, it's also good to have some lighting in there too, so that they can see what's going on. They're maybe losing their vision, and you don't want to be walking around in a dimly lit room and tripping on different items like stools and things that are laying around that maybe they misplaced or dropped and falling down. That can be as detrimental as a loose rug that we talked about. Some interventions for home management, for leisure, is going to be dealing with things that they want to do in their daily life, like watch TV, read, that kind of things. So when we're talking about losing your senses and not being able to see or hear, then that comes into listening to the TV and having to turn it up louder, or possibly getting some kind of like headphones so they can hear that, or even just using closed captioning would be fine. With a remote, you want to make sure that the remote has big lettering so they can see it, easily seen, and they have those kinds of universal remotes for the older population. If you cannot read small print in the books, they always have like technology now where you can scan it and it'll actually increase the size of it on your phones or computers so that you can see it, or you can always just use a magnifying glass. Computers, we have the problem with the small keys, again, like the remote, but of course they always have options to enlarge the keys so that you can see them. When you're teaching an older individual, like we talked about, the problems is their senses are dulled due to old age, not always because of a disease process, just because they're getting older and their senses are degenerating. So if you're going to be teaching, you want to ensure that you have like a bright display. If it's going to be a PowerPoint with large letters and numbers, maybe something that can keep their attention, or something to give them cues so that they understand what's happening. With hearing, you want to be loud, because they may not have their hearing aids in, or they may be turned down too low, or they may not even have them and still have hearing loss. So you need to be louder. You don't want to do a lot of like high pitch, because that's the first thing to go with your hearing is the high pitched noises. If you're actually doing like a teach back scenario, you have to keep in mind that the older population is going to have less sensitivity in their fingers and less dexterity, so they're not going to be able to actually like handle things as easy. So you just got to give it some time and try to teach how they could handle it in that event. Cognition is always a problem due to like Alzheimer's, dementia, and that kind of thing. So you want to reiterate the really important points. You don't want to go over into a bunch of junk that is going to overwhelm them. Just go ahead and stick to the very important points so that you can get the points done here. Alternative care options would be, like family members that live in, or have them come live with the family members, that kind of thing. Like or home health care that's going to come in and maybe like twice a week and help them out. And really, if they're able to and need more help, there's always assisted living facilities in which they can go and have like 24-hour care to help them anytime they need it. If they need things like their activities of daily living assisted, then that's a great place to have somebody there to help with laundry and that kind of thing. And that's the end of the presentation. Thank you for watching, and the end of the gerontology safety. I just lost my train of thought here. Safety and environmental problems. Thank you.